Hey guys, and welcome back to part 2 of the Knee and Learn Your Body Thursdays. Of course, you should watch part 1 before watching this video. This series is about teaching you and providing you with practical knowledge that you can apply to keep your joints and body healthy all the way from head to toe. So we've landed on part 2 of the knee, more of the practical application. I talked a little bit last week about how you can correct some things at the foot, making sure that it is in a proper position. And then we also talked about a little bit about the positioning of the knee and how your genetics may influence that. Now there's some other things that you can do to help the knee, help support it. For one thing, a lot of your support is going to come from your hips and then also your ankle. So when we're thinking about the knee, and if you're one of those people that slams their knee back, guess what? That's going to create a lot of compression at the knee joint. So if you're one of those people, I highly encourage you to start getting out of that habit. The best way to start to feel that in your own body is to put your weight back on your heels a little bit, purposely go back into that hyper knee extension, and then just let go of it. That'll usually be enough to take people out of it unless you're severely hypermobile and you're locking out on your bones. When you lock out on your bones, then you are no longer using any of the supporting muscles and they get weaker and weaker. If you're somebody that likes to hang out way over on one hip, like maybe you just kind of hang out on your left hip, probably going to develop some bursitis and perhaps some knee problems as well. So we can influence the position of that by making sure our feet are hip distance apart and we are standing on our heels. We're not leaning way forward, putting a lot of pressure on the front of the kneecap. Some of these simple lifestyle things make all the difference in the world. We also want to make sure that to influence the knee, that when we're standing, that our butt isn't tucked under and we're just sagging into our posture. Because when we sag into our posture and we let our butt drop down, I don't care what society's told you. Stick your butt out. It's really important. I mean, if that butt is tucked down, it's going to get weak. It's not going to work. You won't be able to walk correctly. So please stick your butt out. Forget everything society's ever told you, ladies. It's super important to have that butt up and being able to use it to help you walk properly. Use it to go upstairs. We need to walk with our butt. We need to push with our butt because a strong butt is going to be helping the knees. This is not the time to be going to the gym and trying to strengthen the quads more. There's almost nobody that needs to do this exercise with their leg fixed and loading this up with all kind of weight. It's not about making the knee stronger. It is almost never about making the knee stronger. The only time it's about that is if you've had a stroke, you had some kind of paresis, or you had recent knee surgery where they actually had to cut through the muscles in the quad. In that case, sure, we would need to reactivate some of those muscles. But in almost all cases, I can say it is not about strengthening the quads. It's never about strengthening the quads. It's usually about strengthening some of the small muscles around the hips, like your gluteus medius, working on that abduction of the hip, making sure that the glute max on the back of the hip is also strong, so we're able to keep those muscles strong. Usually it's the back side of the body for most people that needs strengthening. And then looking at the balance of the hip flexors, your IT band. If that's tight all the time, that's a sign, guys. That's a sign that you are not using your pelvic muscles correctly in order to stabilize. And then this gets really taut. And if you're always doing motions where you're just running straight forward, if you're a runner, critically important that this is nice and long instead of just like this brick, like I could pull it like a guitar string and play a tune on it. We want that suppleness there. And sometimes you need some tissue work to be done there and then to work on the glutes around that. So that is part 2 of the knee. Next, we will be moving up into the hip. And of course, if you've had any knee problems, if you've had experience, what kind of things have worked for you in regards to the knee? And what things have not worked for you? Have you had knee pain? What have you done about it? Have you done any of the things that we've talked about in this video? Leave a comment in the comment section below. Of course, check back next week for the next episode of Learn Your Body Thursdays. Tomorrow is TGIF, Talking Gut Immuno Fridays. where we talk about gut health and sinus health. That sounds like something that's interesting to you. Of course, be sure to check that out tomorrow. Thanks so much for joining, guys, and I look forward to seeing you either tomorrow or next week. Have a good one.